Hello and welcome to the Bridging Borders series. I'm Hannah Hundal.
And I'm Sai Radhigopal.
And today we're bringing you an interview with Governor Lourdes Leon Guerrero of Guam, who will be speaking about her government's response to the coronavirus pandemic.
We started this series because we've noticed a worldwide pushback against globalization. We bring together presidents, prime ministers, and other world leaders to deliver their messages directly to you.
We combine our experiences in healthcare and foreign policy to show you how different governments aim to beat this pandemic. We show you all of our interviewees' responses unfiltered, so you can see what strategies are working and what strategies aren't.
Even in times of quarantine and isolation, we want to show you there are leaders who are bridging complex divides and borders. Here now is Governor Leon Guerrero of Guam.
Hello, Governor. Great to meet you. Thank you so much for taking the time to do this. We really appreciate it. And we know you're very busy, so we'll make it brief. So, Governor, the prevalence of COVID-19 in Guam has remained relatively low compared to on the mainland. Can you paint a picture of what types of preparative efforts you have initiated on the island?
So I have a very close communication with the Director of Public Health and Social Services. And when she started getting alerts from CDC and also from the World Health Organization about a situation that was happening in Wuhan with the coronavirus, I think it was like December, January, we were tracking it. So I was very concerned about it. And so February, the very first situation that made me really concerned is that the whole cruise liner situation with there was a traveling cruise liner from Japan or from, I think it was from Hong Kong, and it wanted to dock in Japan, and Japan said no, and then it wanted to go to South Korea, and South Korea said no. At this time, Japan and South Korea were starting to see the COVID, and also China was starting to do COVID, right? So in first week of February, the Undersecretary of State, the U.S. Undersecretary of State, asked me if we could allow this cruise ship to dock. And I said no, because and of course he was very upset about it, but I just said no, I don't want this cruise ship to dock because I don't know what this cruise ship is bringing. And so then we kept tracking it. China was really increasing. And so in March 13 or 14, I declared a public health emergency, even though we didn't have any cases. And the reason for that is so I could have the ability to move resources and to prepare and to plan for this in case it came. 2 days later, we got our first 3 cases all at once that were positive. So at that point, I declared non-essential businesses to close. I declared non-essential government employees to stay home. And then we progressively did measures based on what we are saying. So long story, but the answer is I think we were very, very early in instituting the measures. And we were very aggressive in instituting the measures. In fact, I rejected a Hong Kong basketball tournament here that was one of the qualifying basketball tournament for the basketball. It's like basketball Olympics, I guess. And then I also canceled a huge annual marathon that we normally have here. We canceled that. Then we started also, our first contact case was from the Philippines. So we then instituted quarantine measures. We mandated quarantine from the Philippines for even our own residents. They had to stay in our own government quarantine facility. And then we also mandated quarantine for now the US that's coming in, and that's still continuing. So we were very strict in our quarantine measures because my thinking there is let's just cut it at the point of contact, right? So if the cause is coming in from outside travelers and so forth, let's do whatever we can. I cannot stop flights. I cannot close borders because we are not an independent country. We are a U.S. territory, but I can deny entrance in. So I can say, okay, if you are coming from South Korea, China, or somewhere, when you come in, we're going to quarantine you. So that's within my authority. So that's what we did. And it was a good thing because we caught 3 in the quarantine who are positive. And just if that had gone out to our community, we would have more. So I think with public health also program and their people for contact tracing and diagnosing and monitoring and so forth. I think that's why I think the highest positive that we ever had in one day was 11.
Okay.
So so you could see from the point of measure implemented, 10 or 11 days later, we started going down.
Right. You mentioned the cruise ship, and I want to get your take on the news about the Navy ship, the USS Theodore Roosevelt, recently docking in Guam, and the fear over that being a potential source of transmission. What is the opinion of the local population about this event, and has the federal government provided any type of support to navigate the challenges that could potentially arise from the docking?
Right. So I did not decide to allow the sailors to be outside of the base. All along, when the admiral knew that the ship was coming, and he knew that there were 1 or 2 people that had positives, and he assured me that when they come, they are not going to go outside the fence. So when they came, and then the situation was a little bit more complicated. The situation was a little bit more serious. And the plan was to try and move the sailors out of the vessel and put them out in places so that they could start testing them, monitoring them, that kind of stuff, right? And they didn't have the capacity. There are like 5,000 sailors there. So they didn't have the capacity. So he asked if it would be okay to have them stay in our hotels. At that point, our tourism was really almost zero. So there were really no people in the hotels. So it was a very opportune time because the facilities were there and the capacity was there. But I did not make the decision without assurances that our community will not be exposed and there won't be contact of civilian and military. And that has been complied to this day. The community's response, there were some that were very concerned about the exposure, but I think once they realized that the military was going to have very strict security, these sailors were not going to leave the rooms, they were going to have security monitoring their activities and their whereabouts. And if they were going to if they got out of the room, they were immediately taken back to the base. Right. So the sailors were also educated. They were all tested and they were tested negative. So that was another security. That was another good thing to prevent exposure and contamination, right? So they were all negative, tested. He only sent out those negative tested. The ones that are positive stayed within sight the fence. We had the capacity and we had conditions, and they met all those conditions. They followed CDC guidelines. They signed papers saying they will comply. If they don't comply, there'll be, violation will be dealt with the U.S. Conduct. So our community here, Henna, is very patriotic. And they were all very, I think, welcoming. they said these are our sailors that are out there patrolling our waters and keeping us safe, and they're also sacrificing their lives. They're asking for help, and we have the capacity, we have the assurances, and my main focus was, how do I protect my community from this potential exposure and contamination, and still help our sailors? And so it worked out really good. Some people were even saying, "Hey, if you don't have room at the hotel, come stay with me.
Wow.
We can set up a canopy and that kind of stuff." So for the most part, they were. And the key too is the admiral and I communicated very well, and the admiral and I conducted press conferences together. So people would ask, the journalists will ask questions, and we would answer those. And so it was. I think we handled it all in terms of messaging, in terms of communicating, transparency, and so forth. And of course, the story, right, with the captain being removed, and then the Secretary of Navy came, and we still have they're still here. I think you probably know they have over 600 positives. They're trying to remove them all out of the vessel. So they're doing cleaning and deep cleaning and so forth, because they want to make sure that when they go out to sea, that all the sailors are healthy and they're negative, and hopefully they eliminated COVID-19 in their ship.
Yeah, Governor, you mentioned the dramatic decline of tourism to the island. How are you dealing with the economic impact of the pandemic, especially given the fact that non-essential operations on the island are now shuttered?
Yes, so we continued allowing people to go to grocery stores, to go to the pharmacy, to go to their medical clinic, to go to the gas station, things like that are essential, right? Go to the hardware store in case, something has to be repaired in their homes. But basically, they are to stay home. Our tourism, Guam's economy is by tourism industry and by military spending or government spending. Those are the two main, local government and federal government spending. And so fortunately, our local government spending and our federal government spending are still pretty active. Our tourism, which is the major, I think 40% of our GDP or 20% of our GDP is from tourism. And so it's a major contributor to our economy. We are very thankful with the CARES Act that was passed. We have taken the opportunity to avail of those federal aids. Our business people have taken the opportunity to use the PPP, the Pay Protection Project, and also the individual assistance in terms of the economic recovery stimulus. So we have those that are helping our individuals and our businesses to try to hold over. So right now we are slowly moving into recovery. We are monitoring we are going to be doing more expanded testing. And, so far our numbers are really low and our hospital capacity is good. And so now we just have to make sure we do a contact cases tracing, and we do also testing. Testing is the key in terms of giving us a picture of how our community spread is out there. Are we seeing more? And as we know that as we test more, we'll have more positives. But how is that in relation to our capacity of our hospital in terms of if there is serious cases and serious illnesses, will we be able to deal with our community that way?
Right. There is a shortage of test availability on the mainland. What is the situation like with availability on the island?
It's the same here. We have limited, but we have about 5 machines that we can use. And, numbers that were calculated and studied through, Mayo, Harvard, and so forth are saying that if we have the capacity to do 258 tests a day, that's a good testing capacity. And once we get that capacity, we'll be fine. So we're starting to see now our test kits coming in for the various things. So we were just talking about this just the other day, and we probably will be meeting our 258 tests a day. So our capacity will be there. Of course, my goal is to test everybody if I can, but I know that's not a realistic goal. But if I test as many as I can and focus on those populations that may have the infection, but they don't have the access to medical care, come in, that we're focusing on those.
That was wonderful. Thank you, Governor. We really appreciate your generosity with your time and your insight. And I know you're very busy, so thank you so much for doing this. We really appreciate it.